episode of BraveTV, and we are so pleased to be able to bring this virtual program to you, broadcasting from my home office here in Virginia. I am Jennifer Marshall. I'm the co-founder and executive director of This Is My Brave, and I'm so glad to be with you here today. When the coronavirus first hit last month and came to our attention, we decided that as an organization, obviously we needed to pivot. This Is My Brave has been built upon bringing live performances of creative expression, those individuals from the community who are ready to tell their stories of living with mental health and substance use disorder conditions. We're built on these live performances. And so when the coronavirus hit, as an organization, we took that very seriously, of course, and we had to shift our shows from the live performances where we have moved our spring schedule to the fall. Fingers crossed that we're going to be able to do live performances with a gathering. And we're just taking it day by day, just the same way the whole world is. And so thank you guys so much for joining us. I see we have Deanie and we have Molly from New York. Molly, it's so good to see you. With our shows moved from the spring season over to the fall, the shows that were in development for the fall have moved to next year, and we're creating virtual content to be able to still share these powerful stories with you. So what came about? Well, I have to say, first we started with some simple virtual content where we decided, coloring is something that is very therapeutic, art therapy, and our graphic designer Richard created some coloring sheets for us, and we're doing coffee and coloring every Tuesday at 9 a.m. Eastern time on Instagram Live. So you can join us, and we have coloring sheets on our blog, and we will likely be continuing that through Mental Health Month in May, because people have told us they've found it helpful. And just being able to sit down with a coloring sheet and focus and take your mind off what's going on in the world is something that we want to bring you. So if you have the time to join us for about 20-25 minutes on Tuesdays at 9 a.m., please do. And then we also added on Easy Flow Yoga with Casey on Wednesdays at 2 p.m. on Instagram. And Richard's joining us. Hi, Richard. And then we also created our Brave Storyteller Workshop that we offer on Fridays at 11 a.m. with Laurien Hope, who is a certified peer specialist and storytelling guru. She loves to just get in there and teach, and she's got such great energy. So we hope you can join us on those virtual events. And then this is our newest creation, BraveTV. And for this first episode as a team, we decided that obviously what's crucial right now is our first responders, what's going on the front lines of the coronavirus pandemic. So we reached out to several of our Brave alumni and wanted to bring their stories to you here today because they are out there and responding to what's going on, and we wanted you to hear from them. So I am so pleased to introduce our first guest and my co-host today, and I'm going to bring in James here. Give us a second. This is our first time using this technology. Hi, James. James, how are you? And you know what? I messed up on the name. Give me a second here. Let me fix this. But James, give us your introduction for everyone at home joining us. Let's hear about your background and fill us in.
Sure. Hi, everybody. My name is James Boomhower, as is so eloquently written on the screen. I have been a paramedic now for 18 years, and I am a critical care transport specialist paramedic with Boston MedFlight out of Boston, Massachusetts. And I'm the founder of a mental health and suicide awareness advocacy campaign called Stay Fit for Duty.
Awesome. So, James, let's go into, if you could give everyone also just a brief background of how you got involved with This Is My Brave.
Oh, absolutely. This Is My Brave came to Boston in 2018. I'd actually been connected through a gentleman named Stephen Kovalkovich, who was part of This Is My Brave in New Jersey a few years before. I heard his talk. It was amazing. And I said, how can I share my story? How can I be a part of this? And he looped me into all the right people, and I auditioned and was chosen to be part of that cast. It was absolutely amazing. It was very, very cool.
Thank you so much. I'm so glad you were part of that very special show. That was, I think, the last show in our 2018 season that fall, because, right, wasn't it November?
It was, yeah.
Okay. So if you're okay with it, I'd love to show everyone a very brief clip of your performance.
Please, that'd be great.
Okay. So let me adjust our screens here, and I will let everyone know as I'm doing this, this was your
I refused to be a statistic. I refused to be broken down to a little black ribbon or a little black sash that we'd wear in our uniform for a few weeks as yet another talented healthcare provider or first responder lost their lives to suicide. Helpers can need help. Helpers can get help. It does not make us weak. It makes us better helpers.
That was it. While we're waiting for Jen, that's the key point. That's everything that I try to bring to the table, and some of our other guests today are going to try to bring to the table as well. Our frontliners that we all recognize now more than ever, our healthcare providers, our multidisciplinary teams, go through a tremendous amount of stress each and every day. And it's so tremendously important for everyone to know that just because you are a helper and you are one of the people with the training and the commitment to help others in their time of need does not mean that you can't also need the help and that you shouldn't be able to get the help.
So true. And James, so one of the things I was curious about as a first responder is something that you shared with me, I think, backstage, kind of before, it was either before or after we went on for your show in November. But how does a first responder look out for other first responders? And what's your kind of protocol of how you go about doing that? Would you share that?
Sure. As with everything in the world, there's a number of different protocols depending on kind of the rules and regs you follow. I think really absent of any formal training or any formal crisis intervention approach, it's just looking. It's just recognizing what your colleagues are going through and remembering that the stress and anger and frustration that you're feeling is more than likely the exact same stress, anger, and frustration that your teammates are feeling, and recognizing that and reaching a hand out and acknowledging that it sucks and acknowledging that it's hard and acknowledging that it's really, really traumatic can really go a long way in opening up that dialogue and being able to communicate that instead of each healthcare provider feeling like they have to hold up this big shield. You know, I'm okay, are you okay, kind of a thing. Just acknowledging what we're going through and normalizing the stress that it causes.
And is there any kind of way that you would say, like maybe like a checklist on, so in the mental health field, there's something called Wellness Recovery Action Plan, or WRAP. And it's kind of like a checklist of how an individual, like say for myself, someone who lives with bipolar disorder, and I've had a number of hospitalizations, it's, if it ever happens again, I end up having mania that leads to psychosis, how my support system around me can intervene and help, and what I would want them to do for me. Is there something similar in the first responder community that you've maybe used yourself?
There is. I think, as Tracy will be able to tell you too, in the critical care and intensive care world, we live or die by the checklist.
Mm.
There are a number of very high-risk procedures that we do every day, and we do those safely by ensuring that there's a checklist in place. Many of us in the crisis and peer support world are advocating for something very similar to what you pointed out. Especially now where we have the venue for everyone to recognize how tremendously stressful it is to work in healthcare. Instead of asking your loved ones and your teammates to kind of guess what you need, to be able to sit down and put that on paper and share that with people. So your colleagues and your family and your significant others can literally go through that checklist and say, have you done this? Have you eaten? Are you hydrated? Have you gotten rest? Have you taken a day off from work? Don't pick up that overtime, stay home. Rather than making someone try to figure it out on their own on the fly, especially when, as you pointed out, you're in crisis and the least apt to be able to tease out what you need in that moment.
Exactly. So take us through, I guess, for our audience, as a first responder, you just mentioned a number of the things that you can do to make sure you're taking care of your mental health. But could you give us kind of an example of one of your days? You get home from a long shift of being on the front lines. What do you do when you get home?
Definitely depends on what time I get home, for sure. I really encourage that everyone has a routine when they get home, with my disclaimer of I'm a single 33-year-old, so I don't have children. I don't have all these other people that are demanding of my time when I'm not at work. But especially now, as we talk about personal protective equipment and the contagion of this virus, I have a very purposeful routine of not wearing my uniform home. I have a purposeful routine of showering as soon as I get home, and that shower kind of acts as the metaphorical like end of the day. Like my healthcare provider hat is hung, it's hung somewhere else. Now I can focus on rehydrating, which, as anyone in healthcare can tell you, is tremendously hard to do when you're working. Eating food if I haven't eaten, and being mindful of what I'm choosing. Sometimes what I want to eat and what I should eat are two very different things. And then really working to give myself some time to do whatever I need to do. That might be shut my brain off and watch some TV. That might mean get a quick workout in. That might mean just acknowledge that it is far too late in the day or morning, depending on when you're getting in, and that you just need to capitalize on rest to get a head start on the next day. But again, making those purposeful, making them actionable, and making them routine, because the more you do it, the easier it'll be to do when you're stressed and when you're tired and when you don't want to do it.
Yeah, those are really important tips, and especially being mindful of the time. And so there may be a day where you aren't able to get it in, but then making sure you set a little extra time the next day to get it in. I was curious when you mentioned about the shower, because I feel like it's one place where you can practice a mindfulness exercise that I'm wondering if I've heard of it, where you can kind of visualize the water kind of cleansing and just letting yourself feel that relief of a rinse, I guess you'd say. I mean, have you ever heard of that exercise?
I have, absolutely. I personally am a huge fan of the box breathing technique.
Yes.
I know it has a million different monikers depending on where you heard it, be it in the military, in yoga practice, in civil service, wherever. It really is my time. I might not put as illiterate a spin on it as you did, but I like that. I'm like, okay, I'm here, I'm in my home.
Yeah.
I'm washing myself. Like once I step out of here, I'll be literally fresh, right? But the day and everything that I saw will be over, or I can allow myself to process what I've seen and the stresses that I've seen, and put that in the appropriate part of my brain. Yeah.
That's good. I also have to mention too, because I think a lot of times people don't realize, but first responders, I think, are at a higher risk of, mental health conditions, right? Because they are exposed to so much in their duties as healthcare professionals. But we have a special offer with BetterHelp.com, which is an online counseling service, and I use it myself. So I personally can vouch for how beneficial and worthwhile it's been for me. And I've been using it for about 8 months now for therapy, and they're offering our viewers one free month of therapy. You just go to betterhelp.com/thisismybrave. And it's a great resource, especially in what we're facing right now, to try it out if you've never, maybe if you've never even done therapy, or if you've just never tried online therapy. And I actually hadn't. And I don't know if you feel comfortable, James, kind of sharing your take on, have you ever tried online counseling or?
Absolutely. As Jennifer knows, and as I'll tell you, I am one of the lead peers in my agency's peer support team. And in that, we have, similar to what Jen said, we have an employee assistance program, we have first responder counselors, we have kind of marriage and family counselors, and we have an affiliate with an online therapy program as well. And when I started that, I did it kind of under two frames. I did it as, I want to see what this is about, and I want to see what this is about so I can advocate it for my team. Any healthcare provider has a really good BS meter, and I want to make sure that anything that I send to my colleagues or my team has been filtered as best it can through the BS meter. I've used a platform that I really enjoy. For my schedule, it's definitely very nice that there are very few time restrictions. The medium, I think, for a lot of people, especially for men, well, I don't mean to make gender specifics, you have a layer of anonymity. You're not, the one that I use isn't a video calling feature. So you're texting with a clinician. And I think that layer of, I'm in my home, I'm on my phone, right? That there are these barriers between the mental health provider and myself. Can make me a little more willing to open up or be emotional rather than having to be at someone else's office, talking to someone else face to face where I can't necessarily hide the emotion that I'm feeling right now. I find it really, really helpful.
That's a good point. And I think that it's a stereotype that men aren't as, open to sharing their feelings. But I do think you raised some points that, are needed to know. So thank you for sharing that, James. I really appreciate it.
Thank you.
So we're going to go, thank you so much for all your insight. We're going to go over to Traci for a few minutes here. And Traci and I got to know each other when she came on for This Is My Brave Orlando. And Traci, I'm sorry, I don't have your credentials on here, but I'm going to let you do your intro because everyone would.
You froze on me, Jen.
Yes.
You froze. I'm sorry.
No. Can you hear me okay?
Yes.
Okay. Sorry. Could you go in and share with us your background? Give everyone a chance to get to know you.
Sure. I'm Traci Powell. I've been a nurse for 28 years, with the last 9 of them being as a nurse practitioner. Right now, I currently work in a neonatal intensive care unit, but come December, I will be certified as a psych mental health nurse practitioner, and I'll be transitioning out of that because I own a business called The Rebuilt Woman, where I help women who've been through trauma. So that's my focus right now, and eventually, come next year, I'll be focusing primarily on helping women specifically. Also, not meaning to get gender specific, but live with trauma and PTSD.
Can you give everyone a little bit more insight into the organization again that you're running?
The Unmasked Nurse you want me to talk about? Or
go back to, I'm sorry, I'm drawing a blank on the name because I was just trying to text my family. Stay off the internet. Tell me.
Which one? The one I started for COVID or my original business?
Your original.
Okay, so The Rebuilt Woman came about because I had been through a lot of abuse as a child, and I plowed through life trying to escape all that. And I thought I left it behind. I built a life. I got degree after degree. I had a good job. I had a good house, nice kids. And then at the age of 46, my brain said, nope, can't hide from this anymore. And I found myself having major panic attacks, and I was in a deep depression until ultimately I tried to take my life. And I learned that night that I couldn't let this thing take me down because I had these 2 kids that I adored and I needed to be here for them. And then soon after that, I met a nurse. So I started to tell my story a little bit, and this nurse said to me, me too. And she collapsed in my office and told me that she had planned to take her own life 2 nights later when her kids were sleeping at a friend's house. And it was at that point that I knew I could not be quiet about this anymore, that we need to talk. Especially as professionals, we need to talk because so many of us try to hold it in and just keep the face that we're okay until we're just not okay anymore.
And was it soon after that that you reached out to us about creating a This Is My Brave show?
It was that, I think, October. I was searching resources on the internet, and then I found the This Is My Brave website. And when I saw what your mission was, and that it's to break the stigma, which especially in healthcare, the stigma is horrible. In the last 18 months, in my health system alone, we've lost 3 neonatal practitioners to suicide.
Oh, heartbreaking.
And all 3 of them were people that everybody said, who knew?
Yeah.
And I would have been that same practitioner where they would have, people would have said, well, she was, led us in so many meetings and did so much stuff, was a leader. And then so shockingly, I'm gone. And
I think it goes back to, Brene Brown says that when we hide, we keep things in secret, shame, it thrives on that secrecy and silence. And when we're able to open up and talk about the hard things in life that we've been through, it removes that shame, and eventually you can feel empowerment from sharing your story.
Right. Part of it with being a healthcare provider, though, and I hear this repeatedly, is when I, as a nurse practitioner, when physicians have to fill out forms for their new jobs and get credentialed, there's a line in there that says, do you have a mental illness that could impact your job? And the truth is, I have a mental illness. It does not impact my job. I do the things I need to do, but that line terrifies people.
Yeah.
And so it pushes people into silence and not want to come out and say and ask for help, because even in recent weeks, we've had some nurses who are struggling. And when I suggest they call our employee assistance program, they won't do it because they're afraid of that question that says, what if they find out I have a mental health problem?
Yeah. Weren't you and I talking about this where you mentioned you might be trying to lobby to get that question removed?
Yes, but it's not been easy.
Mm-hmm. It's a process.
So part of that is just being vocal and saying, it's no different than if you have a physical condition. If you were diabetic and you were managing your diabetes, that's not preventing you from doing your job well. My PTSD doesn't prevent me from doing my job well because I've learned what I need to do to manage it.
Yep.
And when we have healthcare workers with healthy minds, they're going to do better at their job.
Mm-hmm. Well, keep working on it, please. And we appreciate you. We appreciate you. So take us through when the COVID virus hit. Tell us about your what first was going through your head and how you responded.
I responded on so many levels because, my PTSD came into play as well. It was a little bit terrifying for me because this virus, we're not sure how it's going to impact people who get it. Some people barely have symptoms. Some people end up dying from it. And that was very worrisome. Just in the beginning of all of this, my father passed away. So I was dealing with that. And then the fear that I could go to work and potentially pick it up and bring it home and take it to my mother, and then she could get it and I could lose her. It's just been, that part of it's been hard enough. But then going to work and hearing our nurses talk about the stress of what's going on. And our hospital hasn't been hit as hard as some of the other hospitals, but it's still a real threat. And we have had masks limited to us, even when we don't know if we're going to have a patient to take care of. They would give us one mask and say, here, you have this for 8 hours. And so there was a lot of stress over that. Are we going to have adequate equipment to protect ourselves? And then there's just a lot of guilt that goes along with all of this. And I see it in my own daughter, who just recently, 3 months ago, started working at my hospital. She decided she wants to be a nurse and is a tech. And she started saying, I'm going to pick up more hours. I need to be there. I need to help. And there's this, because we're helpers, we want to get out and we want to help.
Yeah. And
so people are having these horrible bouts of guilt because I feel guilty when I'm at work. I feel guilty when I'm at home because when I'm home, I want to be helping at work. And it's just been this vicious cycle that keeps feeding itself.
So that led you to then create the Unmasked Nurse. Am I correct?
Yes. Well, I woke up one morning in the midst of all this, and there was a picture on the TV, or maybe I saw it on Facebook, of 3 nurses in New York wearing trash bags for protection. And even now, it's going to make me tear up.
Yeah. I
just find it inexcusable that in this country, we're protecting our healthcare workers with trash bags.
Yeah.
And so, and let me just preface this by saying nurses are clearly not the only healthcare workers that are dealing with this, but because I'm a nurse, I started the Unmasked Nurse to raise awareness about the lack of protective equipment. And, one N95 mask could save a life. Yeah. And the fact that it's so hard to get what we need is just mind-boggling. And because I was working with nurses who were also stressed, and they felt that they couldn't raise their voices because they were afraid that they would get in trouble, I ultimately started a group called the Unmasked Nurse, because I realized, they call us superheroes. We are not superheroes. And that analogy kind of says to you, you don't get to ask for help because you're a superhero.
Traci, I'm going to bring James in too. James, are you okay? I'm going to bring you in because I want all of us on the screen here. And then I'm going to remove myself in 1 second. But I want you guys to talk about this as healthcare professionals. And I want to hear kind of your feelings too, James, and you can jump in. I mean, do you feel the same way, like as a first responder, that you have that identity of a superhero and you can't ask for help, or people look to you that you shouldn't ask for help? Do you feel that way?
Oh yeah, that's absolutely the problem. Our academy training for now, Traci's a nurse practitioner, so she has a master's level training versus a registered nurse. The training for a paramedic and a registered nurse are very analogous in time, training, clinicals, etc. And we're all taught really early that you're a helper, and you're taught to have this bravado, and you're taught to have this composure. And even just a few short years ago, we were teaching people to not show emotion at the death of a patient. It was genuinely faux pas to shed a tear when you were telling someone's family that the patient you'd worked so hard to resuscitate didn't survive. So we have this unending kind of cycle of exactly what Traci said. You're a superhero, you're a frontliner, you're the best of the best. And nowhere in there does it say helpers need help. It says you're the best, get back out there. You're the best, go to work with one mask for 8 hours. We love you and clap, 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 and you're awesome. But just like Traci said, if you're found unfit for duty, what happens? We had all the same trouble at any agency I've ever worked at. If I reach out to my employee assistance program, what are they going to tell my employer? And what magic sentence will they say that will get me removed from service, instead of the facts, which are it's completely confidential and they can't report you to your employer. And it's a tremendously challenging stigma to break through. And it's as identical on the pre-hospital and critical care transport side of the coin as I'm sure it is on the registered nurse and frontline side of the coin.
Yeah, so that's why I started the group, the Unmasked Nurse, because my goal at that point was not to speak up about the lack of masks, but to say, as healthcare workers, and in this group particular as nurses, we carry masks 24/7. And then that teaching goes over into your home life as well. Like, I have to show everyone that I'm okay. I'm the strong nurse. I'm the strong nurse practitioner. I'm the strong paramedic. And how dare I let out what I'm feeling? And a lot of the times our families are not healthcare workers, so they can't even relate to what we're feeling. So there's not really someone that you can talk to safely outside of work. So the Unmasked Nurse, the goal of the group was just to say, lay down even the facade of a mask that you have. This is a safe place to come in without worrying about anybody, giving you a hard time for your thoughts, and where we can just be ourselves and express our concerns over what's going on in with the COVID stuff. And so the group has grown. I think there's over 1,000 nurses in there now.
That's awesome.
And it's a nice place for support, just to, just talk about what we're feeling, because it's essential, because I'm really worried about people getting PTSD from this thing.
Yeah, on the peer support side of the coin, there's a lot of that too. The benefit of sitting with like-minded healthcare providers, right? And at some level, the license level doesn't matter, right? I can go to any physician, NP, RN, PCA, tech, right, and say, this is bananas, isn't it? And we're all on the same page, right? So I think it's really important too that the license level doesn't matter. I love the metaphorical and unfortunately well-timed literal unmasking that exists there, but it's so important for healthcare providers to know, that they can talk to their families, because I think, especially as I'm sure Traci can articulate, I'm sorry to put my viewpoint right on you before you even hear it, but there's almost an unnatural fear, right, of being a healthcare provider, especially in this time. And does that mean I'm instantaneously sick, or does that mean I'm excessively contagious, or does that mean that I'm at an infinitely higher risk? And some of these things that are true in one sense, but are also tremendously overstated. And the concern for family members of, should you be going to work? Should you take a leave of absence? Is it safer for you to not go? And having to understand, much like what your daughter said, Traci, this idea of, no, I have to go. Like, this is exactly what I signed up for, and I need to be there for my team and for myself.
Yeah, guys, we did have a question in the chat, and I want to throw it out to you. I'll mention, we already mentioned BetterHelp, where folks can get access to 1 free month of therapy. But someone asked, are there any free resources out there that you guys would recommend? I know also Crisis Text Line is an option, the Suicide Lifeline, but are there any others that you would recommend, a mental health hotline that they could access?
Traci, you want to go first?
Jen just named the ones that I was thinking of. I had been considering too, and maybe people can answer if this would be helpful, of just starting a general group of people who are dealing with the stress of this virus. Because, I'm all about PTSD. I'm certified in trauma and resiliency, and it's my goal to avoid as many people as possible from developing PTSD after this. And the truth is, the number one thing to get PTSD, you have to be exposed to a potentially life-threatening situation for yourself or someone you love in a state of helplessness. And I was actually just talking to a psychologist a couple of days ago about this, that it's hard to even prepare people right now because this thing is so uncertain that what do you say to help prevent PTSD? Because one of the main things we know to help avoid PTSD is talking about the trauma. And so if it would be helpful, I can start a group it's a private group where people can come in and talk about their fears related to it. That's the main thing right now. Is the best way that we can avoid PTSD in the future is talk about how you're feeling. Don't hold in those feelings, because when you hold in the stress takes hold on you, and then eventually it can cycle. And I know people are probably like, well, this disease isn't affecting me, but we all, I think, are affected to some point, because you just don't know. It's such an unknown.
Absolutely. I think normalizing and a ministry of support is really important. And Traci's doing that on her end with the Unmasked Nurse, and I'm doing that on my end with Fit for Duty. And I think it's really important to remember that you're not alone. This is not a unique trauma that you're experiencing in healthcare or out of healthcare. On the free support side of the coin, I know that there are some other online counseling services that are offering some free support as well. There's a program for healthcare providers called Project Parachute, and Project Parachute is offering pro bono tele-mental health for any healthcare provider. And honestly, I'm hearing some comments of, I'm on disability or I'm on unemployment. I would reach out to healthcare providers in your area. Psychology Today has a beautiful find a provider feature where you can put a million different refinements on your search and find people that are close and that specialize in what you're working on or what you're going through. And honestly, I would reach out to them, because at this point, there are so many people that are offering either self-pay at a tremendous discount or free telehealth. Just because it's not advertised on Instagram or on Facebook doesn't mean it's not there. And the worst thing that can happen is they can say no, but here's who you should reach out to.
Exactly.
Right? And it's a tremendously low stakes question.
James, it's the perfect segue into our next guest, Letitia Laurien. I believe she's, oh, shoot, I think we just might have lost her. We are having a little bit of technical difficulties with Letitia, but I'm hoping she's going to be able to jump in. Katie's working behind the scenes in our back end of this platform, Be Live, to try to bring her to us. She's a licensed therapist, and we're hoping that she'll be able to join. If not, we're going to share some information. But this is My Brave. We're also working to create and beef up our resources section of the website under the Find Help section. So please check back there, and we will do our best to make that even more robust for you guys. And I know, like James said, there are so many groups that are offering some assistance in this time that is so unknown. And I think Psychology Today is a great place to start. I know you can research therapists and, like he said, reach out to them. You never know. They may be willing, depending on your circumstances, to be able to offer something. So, and I think to Traci's point, groups are a tremendous way to stay connected right now when all of us are at home, but to connect virtually, whether it's, I know a lot of people who are in recovery from alcoholism that are using the online AA groups for support meetings. To this month actually is Alcohol Awareness Month, so that's a good opportunity there. So what else, guys? What else can we direct folks to in terms of reaching out for help?
One more thing I just wanted to mention, and this is the fun side of things, because one of the ways to protect ourselves is to not be caught up in the negative of it all the time. And so reaching out to people who, maybe don't even have anything to do with mental health, they're just your friends that you can have fun with. And, I know my mother right now, who is just widowed 5 weeks ago in the midst of all this, was really struggling. And we came across, and I get nothing for mentioning this, we just came across this app called House Party. And it's free, and you can bring in friends. And so now once a week, she and her other widowed friends get together and they meet. And it's really helped her grieving process through all this. And it's helped her with dealing with COVID because she's been isolated at home. And so I really encourage you to look for the happiness in this as well. Look for lightness. Watch funny movies. Find something fun to read, or just, get House Party. Connect with people. Don't stay isolated, because that's the thing that really makes it hard to overcome this stuff when you sit alone.
Absolutely. And to Traci's point too, don't forget that you're in charge of what you see on your social media.
Right.
If you're staring at a timeline or a news feed of stuff that just frustrates you, aggravates you, makes you mad, you are 100% in control of what you see on social media. You can mute, you can delete, you can block. I have colleagues of mine in the healthcare world that are really upset with the TikTok fiasco going on right now. If that's how someone's deciding to cope with this, then mute that feed for 30 days and come back to it, right? Don't look at all the negative that you're seeing and think that that's it. This has been a tremendous, tremendous example of humanity. I think anyone in healthcare can tell you they've seen way more good than bad. And I don't necessarily mean in patient outcomes or in clinical sides of coins, but I've seen humans being better humans to one another more in the past 3-4 weeks than I have in a long time. And it's very, very easy to pinpoint on the negative. It's very easy to think about all of the things that are changing. But as Traci can tell you, when we talk about resilience, one of the first things you do is talk about what you do have instead of what you do not have. So take a minute, look around, see what is there, see what is bringing a smile to your face. Take the time and energy you are focusing on the negatives that you're seeing and reflect back to those positives. Resiliency is a muscle just like every other muscle in our body. And it is something that requires practice, and it is something that requires patience, and it is something that you can become better at over time.
I love that, James. And also, Traci, thanks for mentioning the House Party app. I don't know that one. I'll have to check it out. Katie's texting me. We're going to try and get Letitia in. She's going to try one more time with coming into the group on her phone. So we'll give her a shot at that. Another app I wanted to mention, my friends and I love the Marco Polo app, if you haven't tried it.
Yeah.
That's a fun one. You can leave a video message for a loved one and they can check it out anytime. And I love this discussion, this part of our discussion where we're talking about auditing your social media and really finding time to connect with what you're resonating with and focusing on the positive. I think that's really, really important. I had something else. Oh, and so one clip I wanted to show, since we have a second, we're waiting for Letitia, is in the show that Traci produced for us, Orlando 2019. We had a storyteller, Jasmine Rhea, and she was able to share a song that she wrote, an original, that is a mantra of positivity and self-love. And it's such a great reminder in what we're going through today. And I'd love to play a clip of that, if that's okay with everybody.
Yeah.
Let me hide all of your feeds, and then we're going to go into Jasmine's clip here. And let's see if I can show this. And
Hey, wanna change, you're gonna need the truth. My babies protect your ears and your eyes and devilish lies. Block them, keep them from coming inside. You live and you learn, your truth you deserve, your love you deserve. Find peace in your soul. Don't ever, 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 ever let it go. Ah, don't ever, never let it go. Ah, I am worthy of my love. I am one with Mother Earth. I have a purpose to fulfill. There was a reason for my birth. I am more than just a body. I am strong in every sense. I live the past. In the past, I lived in the moment. I overcome my obstacles. I am brave. I'm a fighter. I let go of all the pain. It lifts me higher. I am, I am, I am, I am worthy of my love.
I love that clip. I love her message of just being one with a mantra that really, you know, really hits home and reminds you to look inward and stay positive despite all that's going on. So I'm going to bring you guys back. And oh, Letitia is coming in. Let me see if I can get Letitia in here. I have her. Letitia, I see you. I can. Um, Give me 1 second. We got you. We got you finally. Thank you.
Lord have mercy. I'm
Thank
on my phone, so hopefully I don't be moving too much.
Hopefully this works, but thank you so much for being a part of our first BraveTV.
No problem.
So let's go into, tell us how you got connected to This Is My Brave.
Oh, so my good friend Lauren Hope of Good Girl Chronicles, we're actually in the Hampton Roads area of Virginia. So Williamsburg, Newport News, Virginia Beach, that area. And she actually had This Is My Brave. This would have been our first year having the show here in this area. And she asked me to be a mental health consultant
Yep.
with the show, which I was, overly excited about. And so that is how I knew about This Is My Brave before, but that's how I really got connected into it. So here we are.
Here we
And
are.
you all reached out, which is a great thing.
Well, I'm so glad that you joined the family and being a part of the Hampton Roads production, which will take the stage eventually. We're on a bit of a pause, but also, will you fill us in on your background as a mental health professional?
Yes. So I'm a licensed clinical social worker. I've been in the field of social work for over 20 years now, actually.
Wow.
And currently I'm in mental health. So I do a lot around wellness
Okay.
and using mindfulness
Mhm.
and mindfulness techniques like meditation practices and others. Just trying to teach people how to live in order to better manage health. And I came from a very clinical background, where I was doing a lot of training in mental health agencies and organizations and other professionals in the field. And I started seeing how the helpers needed help. And
Mm.
so I began doing more around mental health probably about 4 years ago. And so that
Mhm.
kind of became my focus. And then I started getting into some mindfulness myself. And so I just started incorporating that in my work. And yeah, so that is kind of what I do now. I pretty much do a lot of therapy, mental health therapy, as well as consulting with different organizations, doing trainings and workshops of that nature.
Well, tell us, it's such a great background and so glad that you're in the profession because we need more social workers, we need more therapists out there. And can you share with us what happened, like when COVID first hit, what you started to see, what you're seeing in your practice?
Yeah, it was rough. It was a rough transition. I think that everything happened so suddenly for
Mhm.
everyone. It's like it was Friday one day, and then
Mhm.
on Monday the world changed. It's like
Mhm.
we were told schools were closing,
Yeah.
stores were shutting down. We had to isolate, and so much happened in the course of a few days. So in our field, things are in place like HIPAA, confidentiality, and most people are, people use telehealth, but a lot of people were being seen face to face,
Mhm.
which creates a whole nother type of relationship than on screen.
Mhm.
So, if you can think about 1 week, you're having therapy with your therapist in session, and then all of a sudden things have to change the next
Yeah.
week. So that can really affect a therapeutic relationship. And I know even with myself, a couple of clients just refuse to do telehealth
Oh, wow.
because of social anxiety, and they fear being online and their information being, having access to. And it didn't help when HIPAA restrictions were kind of dropped a little bit, where
Yeah.
you could use things like Zoom and platforms that possibly didn't have the HIPAA confidentiality on it. So that kind of changed things. And even that, it's just the relationship changes.
Yeah.
It's very different doing things behind screen than in person when it comes to therapy.
Our clinical psychologist who's on our board of directors, Dr. Haley Sherwood, she wrote a blog piece for us about what happened. She said, "Please keep seeing your therapist through this COVID situation because just the stuff you were talking about, the transition, there's privacy. People, they see your home, if you don't put a fake backdrop. So, people, it's a different feeling. But I will say for me, having gone from in person to telehealth, there are a lot of benefits once you get used to it if you're able to make that. Were you able to help some of your clients through that transition?
Yeah, and luckily I had already a lot of my clients. So it hit me with some of my clients, but not as rough as some of my colleagues and peers who are also therapists in the field, who were hit a little bit rougher, especially those in private practice.
Yeah.
And I happen to be with a group practice, so things are even different in that.
Mhm.
And so you have so many different circumstances that we as therapists go through, and even just helpers, period. And
Yeah.
being on the front line of all of this, which is new to the world,
Yeah.
and trying to still navigate as a helper, but still trying to be mindful of self care and watching yourself and what you're bringing home, and
I was
and
just
what.
gonna ask you that. How do you, as a first responder on the front lines, seeing folks who are trying to deal with the stress of everything, how do you take care of your mental health?
So I have been taking advantage of a lot of the free workout apps.
Great.
Yeah, I've been taking advantage of that. I have been on sunny days, I go out and get some, sun to basically either bike ride or
Yeah.
walk around my neighborhood with my kids, play out in our backyard. Um, Eating, I'm trying to watch the eating because it's very easy when you have to be in the house to kind
Yeah.
of just pick up something, and the restaurants aren't really open like that. You just get takeout. So
Yeah.
takeout and just having chips around and things like that is just not a good
Same
thing.
here. You gotta be
So
careful.
yeah, I've been real intentional and mindful about, continuing on my eating habits and
Sure.
and fitness and exercise, and still getting that sun to hit my skin so that
Yeah.
vitamin D doesn't go down during this time. So
Mhm.
just trying to be even more intentional because
Yeah.
of the situation. And this is kind of our new normal for a while. So we
Yeah.
don't know even when this does the kind of, I guess, end. Even coming out on the other side of this is going to be different. It's
Yeah.
not going to be the way it was. And I think it's important for all of us to kind of take this time and reflect on going back into being able to connect with people
Yeah.
and our friends and family, and not using the screen so much. I think we all see the benefit at being able to touch someone and hug
Oh, yeah.
someone, and being able to stand and have a conversation. And so I think it's important in this time to think about some things that we need to change and do differently so that we can start coming together and connecting in a different way.
Yeah.
Technology is great, but there is something that the body needs, just
Yes.
a basic touch and a hug. So hopefully we're taking this time to also think about things of that nature. How are
Right.
we going to make some changes on the other side of this?
I hear you so much. I think we've taken those things for granted for a while, right? And now
Most
this is like
definitely.
a
Even
place of
to look down to being able to go in the store and buy toilet tissue easily.
yeah, right. I know.
It's just so
So
many
true.
things you start to be grateful for,
Yeah.
and when you don't have access to it. And so, yeah, I just hope that we're all doing some reflecting so that we come out better in terms of our relationships
Yeah,
by the end of this. So that's my hope.
I agree. Well, I so appreciate the fact that you're able to join us and the fact that you kept trying because I know we had some technical issues. So I'm going to bring everybody back so we can just do one last um, thing here. Let's see if I can bring everybody in. See if we get James in here. All right, we got everybody. I would love to just go around one more time and just kind of give us a parting sentiment on first responders and mental health and what you want the world to know as they're listening to our broadcast. And let's start with Traci.
What I want the world to know. Well, I think I want everyone in the world, not just first responders, to know that we're all in this together.
Yeah.
So many people are feeling isolated and alone. And I agree completely with Letitia that I hope it helps us strengthen our relationships. But I also know some people who right now their relationships are falling apart because they're stuck in a house together. And so I would just say, do what you need to do to protect your mental health. You need to step away, go in the backyard, take a break, but then come back together with the people that you love and love you. And, we're going to get through this together, but you need to protect yourself. And so reach out to the resources that are out there, and we'll get through this.
That's really great, Traci. I really, really can relate to that. So James, let's go to you on that last parting sentiment for today's episode.
It's simple. It's reach out. I invited all my friends to this. I invited all my colleagues and everybody to come see me on this. And at the very beginning, Jen and I both talked about the importance of having an action plan and a list.
Mm-hmm.
I got 10 text messages and a handful of Facebook messages that said, send me your list. So everyone thinks that we're so alone. Everyone thinks that, nobody's willing to help us. And in an hour, I got more than 20 requests for that. So don't hesitate to reach out to the people in your team. Don't hesitate to reach out to all of the people that are on This Is My Brave and all the professionals and peer supporters that we have here, because we're all, as Traci said, in this together and very willing to help one another.
I love it. Thank you. Thank you, James. Letitia, am I pronouncing, I have to ask, Letitia, is that the correct pronunciation? I can hear you, I think. Are you there? Oh no, are we losing?
Hello?
Yes, I can hear you.
Oh, I can't hear y'all, but you can hear me?
Yes.
Okay, I'll just speak. Okay, my parting words are be intentional. I think that we all, and I think you all said it with the connection, but I think it's just important to take advantage of relationships and be intentional about taking care of yourself. Be intentional of the words that you say, the actions that you do. And that's every day, not just during this course of COVID, but I think we should all just take this time to reflect, be intentional about the various things that we're doing, listening to, eating, relationships, things that we're doing with our family and friends, and making sure that we just remain connected and just remain well. So being intentional is my last words.
I love that. I got to show you that was the most recent tattoo I got. It
Look
says
at that.
intention. I'll leave you guys with my parting sentiment. I have so much gratitude for all of you for what you do every day, each and every day, and especially through this very trying time. So thank you. And I'm going to leave with, I guess I'm going to go to this arm. My parting sentiment is there's hope, that we are going to get through this together, and through the support and through the relationships that we nurture during this time. So thank you all for being here. Thank you to everyone who is viewing. And we're going to hopefully save this broadcast to be able to reshare on our YouTube channel. And I hope that you'll join us for our other virtual events that we're offering during the week. Check out our events page on thisismybrave.org. And also, come back next week. We're going to do another episode of BraveTV. We're going to announce the guests later this week. So I hope everybody has a good rest of your weekend and you're able to relax and have some downtime. And thank you all again so much for being here. Letitia, Traci, James, thank you. And
Thanks, man. Bye-bye.
bye, guys.
Bye,
Thanks.
everyone.